Hi everybody, it's Susie again. I'm giving an update on my video diary, post-op lumbar fusion at L5S1, and that was almost a year ago to the day. Today is September the 9th, 2011, and I had my surgery September 16th of 2010. And it has been a long road. Last time I videoed, I was just about to start physical therapy, and I've tried several times since then from my phone, from my other laptop, and I couldn't get it to upload. And it's been a rough few months, to be honest with you. When I started physical therapy, I expected to have some pain, but it got really bad, and I honestly didn't want to get on here and share that. I wanted to be positive. I was pretty much in denial, trying to do a mind over matter thing that just is not working. I wanted to be able to come on and be positive and tell you how wonderful life was and tell you I was back to work and, share that hope that everything's going to get better. And I didn't want to get on here and scare people with how much pain I was really having, because I really feel like before I started physical therapy, I know for certain that this surgery worked. I mean, there were times before physical therapy when I would realize, going about my errands, I'd realize for a moment, hey, I have no pain, and how cool is this and how different is this? So that's what I wanted to share. When I started physical therapy, the pain got worse and worse and worse. And I ended up going to the emergency room 2 times with horrible sciatica. My right leg was numb, tingly, hot, cold, weak. It was really bad. I ended up having a round of steroids and, oh gosh, bad hair day. Anyway, so, my physical therapist told me that her husband had had a lumbar fusion. And it took him a good year to really start to recover. And that, for the surgeon to say 6-month recovery time to me was really unrealistic. And I'm definitely seeing that now. And I wish that ahead of time I would have been more prepared, because I honestly thought that in 6 months I was going to be better. I mean, I thought I could take the brace off, have maybe a month of physical therapy, and get back to work, and I thought all of this was going to be like a bad dream. I mean, in my mind, I knew that I would maybe feel some stiffness or something for the rest of my life. I would be aware that I had had a surgery, but I had no idea that, a year later, I would still have this much pain. I was just in denial, and I wasn't ready to share it, I guess. So a year later, I can tell you that I would have the surgery again for sure. I would do it all over again, but I'm still having pain. It's still a rough, long haul. The surgeon, it's work comp. So guys, let me tell you, you have no choice about your medical care and work comp. They tell you who you're going to go to. They tell you when you're going to go. When that doctor, for example, the surgeon discharged me back to pain management because I was still having pain, and that was another thing that I didn't want to accept. I just wanted it to go away, but I said, okay, I'll go back. If this is what I need to do to get back to work, I'll go back. So they set me up with the doctor that they wanted, and I have no say in that. Well, when I went to the new pain management doctor, he's done 2 steroid injections. I had no idea that people after surgery still had to have steroid injections. I had no idea. But, I mean, this is the reality of it. Like I said, I'd still do it again, don't get me wrong. And I am going to answer emails. I haven't gotten there yet because I've been trying to get a job. But, somebody mentioned to me in an email, I told them that I was having a rough time and that I really, I just didn't want to share that. I wanted to share the good stuff. And they said, if I'm doing a video diary to document what it's really like for a real person to go through this lumbar fusion, that I had to share the good and the bad. And I just had to be honest about what was going on so people would know. And so that's what I'm doing. I still am having pain, and 2 months of physical therapy and a couple of ER visits and a couple more steroid injections later, I would go through it all again. I just wish I would have been more prepared. So I guess that's what this whole thing is about. when the physical therapist told me that it was more realistic to say it's a good year recovery time, that made me feel better because I felt like I wasn't a failure. I wasn't a loser. I wasn't being a complainer, that it just really is a long road. She told me that her husband had to go through steroid injections post-op, and she actually mentioned that that pain that I have on the left-hand side, it's a very specific spot on the left-hand side that feels like a hot, sharp poking right to the left of my tailbone. She said she thought that was a sacroiliac joint, and somebody that had written me said that they thought that's what that pain was. Well, sure enough, that's what it is. So, I still have that pain on the left, and on the right-hand side, well, at the bottom of where my tailbone is, my lower back, I still have an area that burns tremendously, and then it goes down into my right hip. My right hip is probably the worst, and it goes down into my right calf still, and that feels like a cramping feeling down there. And my hip, it's like a really deep gnawing kind of it feels like it's a bone pain. It's just a deep, sharp, intense kind of a pain. I still get some shooting pains that go down to my right foot, my right toes, my outer toes. So, it's a bummer sometimes. I get overwhelmed with it, from going from a place where I had almost no pain to a place now where I have pain a lot again. And my question for this new pain management doctor was, how do I know if this is still a healing type of a pain that the surgeon described versus I've heard that the hardware can migrate, and that sometimes the screws can move and they can hit a nerve and that can cause nerve pain. So how do I know if this pain is normal or not? So after the 2 steroid injections, when I just talked to the new pain management doctor, he was going to send me back to the surgeon to find out what's going on, because he didn't think I should still have this pain this far afterwards. He wanted to do another MRI, another x-ray, and he wanted to do an injection directly into the sacroiliac joint to see if that would help. I agreed with all of that. Then he said he wanted to stop all the medication, which I have a job starting Monday. I have a job in 1, 2, 3 days to go to. And my fear is, and I tried to explain to him, if the medications that I'm taking already are not working, how is stopping all of them going to work? And how am I going to be able to go to work on Monday? And I was trying to ask him because I just did not understand. What he was saying to me just did not make sense. And I told him, I said, I'm not BSing you. I really have this. I said, if I didn't, I wouldn't be sitting in your office going through this. I would be back at work minding my own business. And I said, I don't want to sit home the rest of my life on disability. I have a job lined up. Work comp wants me to go to work. I want to go to work. So, let's carry on with this. Well, he ended up saying, I'm not going to argue with you and you can go find another doctor. And that was it. I sat there for a minute and then I walked out of his office, and I just called my attorney and said, look, he wants me to get another doctor. I tried to tell him I'm not trying to argue. I just don't understand. I don't understand why I'm still having pain. I don't understand if it's hardware, if it's normal. And I want my life back. I want to go back to work. So, that's where I'm at now. I'm going to go back to work. I don't know how in the world I'm going to do it, because it's going to be an hour and 15-minute commute each way, plus an 8-hour day. It's with a major insurance company doing case management, so I'm very excited, and this is about to cut off. So I'll update you. But that's the reality of what's going on. My attorney is trying to get me another pain management doctor, and I don't know where it goes from here. I would do it all over again because I'm getting my life back and I have a lot more quality than I did before surgery, but I just wish I would have been prepared ahead of time to know that it's more like a year rather than 6 months, and that at a year I could still have a lot of pain. So I hope this helps. I will be answering emails, and thank you all for writing in and sharing your stories with me. And somehow we're all going to get through this, and just know that there's other people out there going through the same thing. So keep the comments coming, and I'll be in touch. Thanks.